You're live.
Hey guys, it's Dr. Emer, and we're doing a great case today. We already have a really good-looking, athletic young male, and the question is, why do you need to be doing these cosmetic treatments? Everybody, DMs my Instagram and says, why are we taking these young women and men and doing these treatments to them? It's because they want to stay looking that way and they want to enhance their signature features. He has a really structured jawline and face, and he's super athletic. And what happens when you're athletic and you're defined is you lose volume as time goes on, especially if you're a runner or you're really into working out. One of the things, a classic thing that we're doing treatments on now is really enhancing the overall jawline and chin area. So what we're going to do for him is kind of do mouth rejuvenation. And when you think of that in a older person sense, that's for wrinkles, that's for sagging. When you think about that in a younger person sense, we're doing defining and we're doing enhancement, especially with lips in a man. We're doing hydration, just shaping. You don't want anything overdone. You don't want the lips walking into the room before you do. That's the key. That's what I always tell people. Subtle and natural. So what we're going to do is he already has a nice chin. It's projected. We're going to make it a little wider and a little more pronounced and more defined. We're using a Restylane product called Define. This helps give us a nice, after people do this, they love it. They get so into it. And my coordinator, John, has a really great jawline. He started out using one of these fillers. I think it was originally Voluma, because that also has a lot of structure and shaping. Then he went to doing Radius, which gave him a little bit more long-term in terms of collagen building and long-term, long-lasting. And then finally he went to doing, because he loved the results, he went to doing Bellafill, which gives the longest permanent results, because I wouldn't tell somebody to do silicone or fat injections in this area at this age. Now all we're doing here is three-dimensional approach. We're just going to soften around the chin itself, and I'm trying to show you guys one side versus the other. You can see we're doing, how does it pain? Is it terrible or is it okay?
Okay.
It's not the best, but it's not the worst. There's some numbing inside here. He's also been numbing topically. We're doing some projection, some width. But you can see here, if you look, turn a little here, you can see the width, and then, for example, you don't, in a guy that has a really bold face and not as narrow, you might want to go a little wider. For him, given that he has little central facial hollowing, which is natural for his shape, and also tightness along his jawline, you do not want to take it much wider. It'll make him look like he has a sports strap on his chin. We don't want that. We just want definition, enhancement of a signature feature. That's what I say. He's doing great. We're just doing really light. Is anyone saying anything, or?
You just answered a question.
Oh, any questions you want to ask me? What do people normally want to know?
How long does this filler last?
Well, these will last about 9 to 12 months, sometimes even longer, because we're on the bone. The big thing is, guys that move, exercise, or talk a lot, the hyaluronic acid sugar-based fillers, they dissolve more quickly, which is why on the rest of the face for him, we do a little bit of Sculptra, which builds collagen over time, which would be very useful for him, especially with his laser treatments and such that he's been doing. His skin's starting to look really good. Now I'm going to show you guys a little trick. Do we have, that's okay. No. You do? Yeah, grab that for me. Open that for me. I'm going to show you guys a little trick with the use of a cannula. Some people, this bothers them and some it does not, but I like it because, turn a little this way, we can literally go from one side of the chin and we can define, go ahead and grab that. We can go right under the skin here, a little deep breath, and go right across the chin crease, so we can literally treat three-dimensionally. It's not the best feeling in the world. He's actually quite amazing. But we can literally go under here and also treat the chin three-dimensionally, because as we age, this whole area starts to lose volume. And we can reorient and go down into the chin itself and do a little bit there. And what's great about using the cannula is the facial artery, which comes right over here, limits the risk of any issues with the cannula. And so that's nice. It's soft. The other thing that's great about Refine and Define, turn a little bit this way, is that they are mobile fillers, meaning that they actually move with the tissue. They almost act like honey. They stick. And what's great about that in people that move a lot or exercise or talk a lot, deep breath, 1, 2, 3, good. They don't lump or bump, just soft.
Can you use define in the lips?
You can. It's gonna be a little thicker, so it depends on the look you're going for. For him, we're gonna do Volbella, right? We're gonna do something real soft. And what's nice also about Volbella, which is a Juvederm Vicross technology product, is it's soft, but it lasts a pretty long time in men. Which is, again, you want to use something natural and soft, but great.
Will Volbella show a little bit of volume?
A little bit. You'd have to use a lot of it. For him, we're only going to do one syringe. That's just to hydrate. We're going to do that right now to complete kind of our around the mouth rejuvenation. But you could see the filler here. This is Volbella, and it's a clear gel. And we're going to do, the lips always hurt a little bit, but he has a nice shape. We're just going to do a very small, I'm going to do a little tap with my finger, 1, 2, 3, and just a little poke. And here's the thing, the Volbella needle is what we call the Gucci needle. This is so little, and it's so hard to find, that it's like pristine. It's like an amazing, 1, 2, 3, good. It's an amazing needle because it is much less pain, and it's a very special one. So we're just doing very small bits. You can even see right there, up at the top, 1, 2, 3. You can even see right there that there's subtle hydration that already went into the tissue. Another one, 1, 2, 3. And it made it just look better already. And what we're trying to do for him is enhance the lift that he already has. You don't want to change the shape too much. Just make it look plump. So see one half versus the other half that's been treated versus untreated. Again, 1, 2, 3. Just get a little pinch right there. Very good. Again, these are the small baby needles. And again, 1, 2, 3, very little. And he's just going to see that subtle hydration. Perfect. Now, you always want the lower to be at least a third bigger than the top. And you don't want to overextend top 1, 2, 3. You don't want to overextend the volume here laterally because he has a nice Cupid's bow. We're going to try and keep that Cupid's bow. Let me just do a little injection through there. I know it's not the best, I'm sorry. Just to do one little lateral injection, and that's it. And that's the lip. So let me see from the front. Hold on. That looks great. Every so often I'll try and get this little bit out, deep breath from the top of the needle, just into the actual pillar itself. And we'll wipe them off. And that's our mouth rejuvenation. Okay, let's show him that so he can at least just see the torture we put him through, if it was worth it, So far I haven't really had too many bad Yelp reviews saying I torture them with filler, because I think they like the result after. We'll take a look really quickly just so you can see the chin and lip area. So a little bit more bold, a little more projected, softening in the lip. Doesn't look like you had it done, it just looks better. It's almost like an internal chapstick. And then he already has a nice defined jawline, so this balance is it. And what also it does is lifts the chin and the neck. So it ends up with filler in the chin area because it recesses, it makes you sag without it, it makes you look a little tighter. So that's mouth rejuvenation in a young male. So now we'll just sculpt it. You can start it. Wait, did we do sculpture the first time?